Objective number one is to make sure that Ebola never reaches the United States. Objective number two is do what we can to help the people of DRC and neighboring countries so it doesn't spread.
Secretary of State Marco Rubio is speaking today on the Ebola outbreak in Africa after the U.S. Department of Homeland Security announced a 30-day travel ban on non-U.S. passport holders from the affected countries. This comes after an Air France flight was about to land in Detroit with a potential Ebola-infected person on board from the Democratic Republic of Congo. Good evening. I'm David Andrews.
And I'm Ann Emmerich. That flight was diverted to Canada. News 10's Jaden Hawkins joins us live in studio with insight from local health experts.
Ann and David, the Centers for Disease Control and Prevention says no confirmed cases of Ebola have been reported in the United States from this outbreak, and the overall risk to Americans remains low. But the Air France flight that nearly landed in Detroit on Wednesday is putting infectious diseases front and center for Michiganders. And health experts say now is the time to stay alert and stay informed.
When you have a person that comes into your emergency room or to your clinic, and they're not well, one of the first questions you're supposed to ask is, have you traveled and where have you been?
Dr. John Brooks with McLaren Health says that question is standard protocol to stop the spread of infectious disease, like the new strain of Ebola virus in Africa.
When humans get infected with it, it does cause troubles with our ability to clot our blood. So we do get a bleeding disorder, which then goes on to cause difficulties with organ failure and then death.
Dr. Brooks says this strain has about a 35% fatality rate, lower than the average for Ebola. But Dr. Rebecca Shine, a pediatric infectious disease specialist with Michigan State University, says this outbreak is worth our attention.
Both because they did note travelers in another country and because we don't actually have treatment or a vaccine for yet.
Unlike COVID-19, Ebola is not airborne. It spreads through direct contact with an infected person's bodily fluids.
The Ebola virus has required direct contact with blood and bloody products of that person onto you, onto non-intact skin, or into your mucous membrane.
Both doctors say Americans do not need to panic, but caution against traveling to affected countries. Dr. Brooks says no matter what infectious disease is circulating, simple steps can help you protect yourself and those around you. Stay home when you're sick, cover your mouth when you cough, and wash your hands often.
Jaden, thank you. You can stay up to date with the current status of the Ebola outbreak by visiting the Centers for Disease Control and Prevention website, and we will be sure to keep you updated on air and online at news10lansing.com.
Looking